Medicaid. You might be familiar with the federally funded healthcare program for low-income families, those 65 and older, and young people with disabilities. It's helped millions of Americans access affordable healthcare. And starting tomorrow, April 1st, up to 18 million people nationwide, about 2.7 in Georgia, will be kicked off of the program. To help me break down why this is happening and what your options are if you are set to lose access is Dr. Kathy Hempstead of the Robert Wood Johnson Foundation. Kathy, thank you so much for joining us here at Atlanta News First Plus. I want to dive into all of this, but before we get started, we got to take a trip back to the pandemic to really understand what happened with Medicaid then and how that's impacting all of us now.
Sure. During the pandemic, the government tried to extend some flexibilities to make it easier for people to have access to healthcare. And one of the most important aspects of that was established during a public health emergency that started in January 2020. And the federal government asked states to go to a process called continuous coverage in Medicaid, which meant that they did not go through their normal periodic process of determining whether people remained eligible for the program. In exchange for doing that, the federal government increased the federal matching rate. But the idea was to keep folks covered during the pandemic and not have people go through these processes where sometimes, even if they were eligible, they would lose eligibility and sort of churn in and out of the program. So the goal was to keep folks covered, and it really worked. And since then, we've reached a historic low in our uninsurance rate, and the Medicaid program has grown as people are sort of coming in, but nobody's leaving.
And, as we talk about this, it's very serious. You're talking about low income individuals, low income families losing access to affordable health care and possibly not even knowing that they're about to lose access. So, out of those who qualify for Medicaid, who exactly is losing coverage and who's most impacted?
Well, it's important to remember that not everyone who loses eligibility for Medicaid is going to become uninsured. In fact, we think that about half of the folks that are going to lose eligibility for Medicaid are going to be covered in employer sponsored coverage. And some of them may already be enrolled in employer coverage because people have been, maybe for a long time were in the Medicaid program a long time ago, and now they may not even remember anymore, and they're in an employer sponsored coverage. So it's important to remember it's not quite as bad as it sounds, but it is still a momentous change in coverage status. So we think that, as I said, about half of people will end up landing in employer sponsored coverage. We think many children will go to CHIP, but there is an estimate that nationally close to 4 million people are going to become uninsured, which is, a huge hit and will drive our uninsurance rate up. And I think we, want to really use the opportunity to remind people that they should be looking for mail from the state or possibly from their health plan that would be encouraging them to update their contact information and make sure that they respond to requests for information that have to do with redetermining their eligibility. And that will help us minimize people that are losing their Medicaid eligibility for administrative or procedural reasons. And those people, really should remain on the program. So that's a really important message to people.
And you brought up a good point. Children are going to be impacted by this. Specifically, Medicaid
Yeah.
isn't the only program here. There's also Peach Care for Kids, which covers qualified uninsured children. As we talk about that, what happens to the kids enrolled in this program?
Well, I think that there's a huge priority in keeping kids covered, and I think every state takes that incredibly seriously. Nevertheless, there is a concern that some kids will fall through the cracks and will lose their coverage, maybe temporarily. We have reached a historic low in child uninsurance rate in this country now. It's something like 3.7%, which is really, really impressive. But it's very important that that parents are watching and that there's lots of outreach to families to make sure that people are providing the information that they need so that they can remain in the Medicaid program or maybe in Peach Care, which is a kind of Medicaid extension in Georgia, or the appropriate coverage for them. So that's a really important point.
And as more states are getting ready to peel back those qualified under this, I want to talk a little bit about the 6.8 million people who are still eligible but could be losing coverage due to administrative and procedural barriers, which is a big word. What exactly does that mean, and why are those people
Yeah,
impacted?
that's a fancy way of explaining what we often refer to as churn. People who are uh, they discontinue their Medicaid coverage, they lose their eligibility for Medicaid, not because they actually are ineligible, but because they fail to respond to the requests from state or county agencies to provide information to to kind of redetermine their eligibility. So an example would be somebody who moves and a letter is mailed to their former residence and they don't get that letter and they don't respond to the message, and then the program determines, because of their non-response, that they're no longer eligible. So someone like that will lose their Medicaid eligibility, but they're actually still eligible, either categorically or based on their income, and they may not even know, and they may find out the next time they go to seek care or fill a prescription, hey, this card doesn't work, you're no longer eligible for Medicaid. And then that, begins a process of reinstating their eligibility that's, tremendously burdensome for patients, of course, and for providers and for health plans and for the state. So there's a really concerted effort to minimize churn, throughout the country. And the federal government is working with states and trying to incentivize them to process these redeterminations in a way where they are following best practices that would minimize churn, like encouraging them, for example, to use other sources of data so that they can potentially automatically reinstate people's eligibility without making people respond to mail. That's something that we're really trying to minimize, because so often that can be missed. People move a lot, people might be living with different people at different times, and so we're really trying to minimize what we call kind of procedural or inappropriate redeterminations that just separate people from coverage for no reason.
We're talking with Dr. Kathy Hempstead of the Robert Wood Johnson Foundation. As you mentioned, there is some work being done to make sure that people are aware that they're going to be hit, and some are going to be hit very hard by this because they rely on Medicaid to access affordable health care. How are states notifying people?
Well, most states have issued a plan. There's actually a number of federal or national kind of tracker websites that show what each state is doing. And, Georgia's issued a plan for how they're notifying different people about this impending deadline. But the problem is that so many people don't know about it. We recently funded a survey that showed that over 60% of Medicaid recipients were completely unaware that this redetermination was coming. And that is not surprising at all, because I think people in general just don't think about insurance. They don't want to think about insurance. They're living their lives. They may not even know that the insurance product they're enrolled in is actually Medicaid, so they may not even think it applies to them. So this is something that is just going to be a problem. So states are doing outreach. States are contacting their Medicaid enrollees in all different ways: email, mail, letting people know. But then also, in lots of states, state agencies are reaching out to advocates and different community groups that also can spread the word. And then health plans are incentivized as well, because health plans don't want to lose their members. So health plans are reaching out and trying to get contact information, and providers in many cases too, they're also incentivized. So everyone's incentives are kind of aligned to try to keep people covered. So these are the different kinds of forces that are out there trying to get the word out. But I mean, I still, people, especially people that aren't necessarily using a lot of healthcare services right now, it would be easy for people to, to not know. And that's why this is, such a critical sort of outreach challenge.
Yeah, certainly. And you as a policy advisor come into this conversation very well when we talk about policy steps that states can take to strengthen their Medicaid programs and really make sure that the people are being cared after. What are some steps that can be taken?
Well, I mean, more generally, I think a huge goal is to expand Medicaid eligibility, which is something that Georgia hasn't done yet. There's a handful of states that haven't taken advantage of that opportunity to expand Medicaid eligibility under the ACA. So that's certainly something. Another thing that many states, including Georgia, have done is expand postpartum eligibility. But I think for Medicaid to function most effectively and provide services to all the people that need it, it would be really important for Medicaid to be expanded in all states to under the ACA, and that way there would be a kind of transition between Medicaid and the ACA marketplace where there really would be an affordable option for everyone. And unfortunately, that's not the case everywhere. But one of the other, in the context of the redetermination, I think just sort of thinking in the here and now, minimizing churn is essential. So anything you can do to get people to either find easy ways to do the eligibility redetermination or to make sure people know, and people that do need to respond to mailings do need to respond. It's a special challenge for people that don't speak English as their primary language. So really getting information out there in all languages and using media and social media and trying to reach people. So that's number one. And I think the other really important thing to do then is for people who actually are losing their Medicaid eligibility, not churn, really have lost it, trying to transition them to alternative sources of coverage. And, for children, for many, it'll be CHIP, and many people will go to employer insurance, but then there will be people who will be eligible for an offer, often, a subsidized offer in the ACA marketplace, and, trying really hard to get people to make that transition, to know about it, to make a choice to enroll in the plan, because I think that is the one factor that will really affect how much like sustained coverage loss comes out of this.
Yeah, and you would think about things like inflation and just the rising costs of everyday goods, and now this on top of that, really hurting families that are just trying to make it by. I want to talk a little bit about options, next steps. What are some resources that people can access if they are about to lose this healthcare access?
Well, if people are truly no longer eligible for Medicaid, for children, many people would be able to transition to CHIP. But for adults, I think one thing is there may be an employer offer that people could take. Maybe it's a spouse's offer, maybe it's a parent's offer, maybe it's their own offer, and that's obviously going to cost more than Medicaid for sure. But that's one source of coverage. And then the other primary opportunity for people would be the ACA marketplace. And many people, Georgia has a very competitive marketplace, lots of plans, lots of low cost options. Many people would be able to find coverage. It would not be at the same price point as Medicaid, but for many people, especially lower income customers, they could find an affordable plan. So I think that's just a huge imperative for people that are transitioning off of Medicaid, is to look very seriously at the ACA marketplace.
Yeah, Dr. Kathy Hempstead, thank you so much. We're going to include a link on our website to all of those resources. I just want to make sure that we didn't leave anything unsaid. Just final words, thoughts as we head into April.
Uh, it, this is just a huge process. If you think about it nationally, 15 to 18 million people. That's nearly as many people as have gained coverage since the Affordable Care Act was passed. And not all those people are going to become uninsured, not by a long shot, but all those people potentially are going to lose or change their coverage status. So it's a logistical challenge that no matter how much every state thinks they're prepared, nobody's really prepared. So I think it's going to be an extremely challenging process, and I think our objective should be to minimize churn and to maximize transitions into alternative sources of coverage. But with that being said, it's still going to be incredibly challenging in every state.
Yeah, certainly, and we'll be following along, bringing you the latest on these developments. Dr. Hempstead, thank you so much for your time. Again, we are following this along with you. April 1st,
Thank you.
that is when all of this is supposed to start taking place for up to possibly 18 million people. So we'll be continuing to monitor this, giving you those resources and links on our website, atlantanewsfirst.com.
Thanks for having me on.